There you go.
Good afternoon. This is Group B. The nurses are going to follow medical and surgical asepsis techniques and principles to avoid occurrences of nosocomial infections. This is our presentation.
Nosocomial infections. Infections which are a result of treatment in a hospital or a healthcare service unit, but secondary to the patient's original condition. Infections are considered nosocomial if they first appear 48 hours or more after hospital admission or within 30 days after discharge.
We had to get a little case from online, from the internet, and here's a little story that we're going to show you. It's Jeannie's story.
In 1996, I had a wonderful job, friends, and family. I was living life to the fullest and had just returned from a trip to Las Vegas where I went skydiving. Then one day I stepped off the curb and broke my ankle. I had surgery at a prominent Boston hospital and everything looked fine. I was expecting a full recovery within a few short weeks. But soon after, I needed a second surgery to increase the stability in my ankle. It was with this surgery that I got the Staphylococcus 3 infection. Because of lack of coordinated care, the Staph 3 infection escalated into a bone infection called osteomyelitis. This infection ate away 4 inches of my tibia fibula and half my ankle joint. Osteomyelitis is a fast-moving bone infection and is almost as difficult to eradicate as cancer. For the next 5 years, I endured 28 surgeries consisting of bone grafts, muscle grafts, and live bone transplants, and other painful surgeries. With each surgery, the physicians promised it would be the last. If the physicians initially treated the infection with antibiotics, the outcome could have been very different. The 27th surgery was going to be another excruciating live bone transplant. 2 days before the surgery, the infection reared its ugly self again, this time higher up on my shin. At this point, I was 105 pounds and unable to keep down food. I was a physical wreck. The infection and numerous surgeries had taken such a toll on me. This is when I decided amputation was the only way to save my life. 4 days after the initial amputation, I had to have another surgery because they failed to take enough off my leg. During this surgery, I went into respiratory failure yet again, a total of 3 times in the last 4 years. It was 5.5 years from when I broke my ankle before I took my first step, and it was on a prosthetic leg. A year from my first step, I had a brain aneurysm on my right optic blood vessel, brought on by the long-term infection in my body. I'm still alive and talking, but now without the vision in my right eye and some short-term memory problems. I've been very lucky to survive all of these medical procedures caused by the hospital-borne Staph 3 infection. I wonder every day what obstacle I will have to overcome. The Staph infection did not ruin my life, but it has altered my life forever. Hospitals and physicians should provide coordinated care for all their patients throughout their treatment. Medical staff needs to follow strict surveillance, prevention, and reporting of hospital-borne infection. Had these practices been in place, the Staph infection probably would not have occurred, and a broken ankle would not have resulted in an amputated leg. Remember, anyone can break an ankle, but that's where the story should end.
Okay, so with this in mind, we're going to give you some little precautions. I mean, not little precautions, but some good precautions that you should always do so this cannot happen to anybody else. Okay, step 1, is you need to start locating an area for performing the surgical scrub and making sure the sink, cleanser, and sponge are available.
Step 2, calls on an assistant and asks for the sterile towel, gloves, and the gown.
Like our little pictures to help you. Step 3, lather and wash hands and forearms using friction for 15 seconds, avoiding splashes.
Step 4, dab sterile towel on arms and forearms.
Last step, you need to walks to the table containing sterile gown and gloves and dons them with assistance from another person. I was like, wow, it's quiet in here. You're all sweaty. Just pretend like they're sterile.
What care should the nurse have taken regarding the placing and donning of the sterile towels and suits?
That's standard universal precautions, and they are, you need to wear clean gloves when touching blood, body fluids, non-attacked skin, perform hand washing immediately when there is direct contact with blood, body fluids, secretions, excretions, and contaminated items. After removing gloves and between patient contact, wear a mask, eye protection, face shield during procedures that are likely to generate splashes of blood and body fluids. Wear a cover gown during procedures that are likely to generate splashes or sprays of blood and body fluids. Clean and reprocess all equipment before reuse by another patient. Handle, transport, and process linen soiled with blood, body fluids, and secretions in such as a way to prevent skin and mucous membranes to exposure. And then last is use a private room for the care of patients who contaminate the environment, patients requiring isolation.
Should the nurse document the surgical scrub performed?
Yes, it is important to document everything for legal purposes, also to ensure quality